Dr. Jen joining us now to take on a subject that's also making headlines. Dr. Jen, let's talk about this. Robert Haddon, who is a former OBGYN at Columbia University, is on trial, pleading not guilty for a rare but devastating type of sexual misconduct. We're talking between patient and doctor.
And this highlights the importance of understanding the boundaries that need to be adhered to in the exam room. As an OBGYN, what are those boundaries that we need to talk about, and what do patients need to understand and be informed?
This is such a tragic but important story for women and men to pay attention to. I went to Columbia Medical School when Dr. Haddon was a practicing OBGYN at Columbia Medical Center. And I was taught, as every healthcare professional and provider is, the proper way, not only out of sensitivity and respect for the patient, but legally, the proper way to physically examine a patient. And of course, this story is really talking about GYN exams, one of the most intimate and anxiety-producing exams at baseline for women. And really, in the rare cases, how wrong it can go and what's at stake. And I think when women hear this headline, they need to understand that there's a right way and there is absolutely a wrong way to examine a patient, and knowing that ahead of time is really important. So, let's go through it. First of all, physical exams ideally should be explained and undertaken only with a patient's consent. It might seem obvious, it might seem redundant, but that is the way it should be done. Draping with, towels or robes or medical drapes, surgical drapes should be used to minimize the patient's exposure, and again, out of respect, so they're not left stark naked in a vulnerable position. Healthcare providers should absolutely make chaperones available to be in the room with a physical exam. I have never, in my almost 20-year medical career, examined a patient without a chaperone in the room, ever. That's for the patient's protection, and it's also for the healthcare provider's protection. And patients should absolutely be offered the opportunity to ask any questions or to interrupt or stop the physical exam at any time if they feel uncomfortable.
And what would you say to women who are watching this, hearing this, and are very uncomfortable already with getting that exam, but now feeling even more anxious
I would
about
say
it?
two things. Don't let a rotten apple spoil the rest of the bunch for the many healthcare providers that do this properly and with respect every single day. And secondly, a GYN exam, if done properly, should take seconds, not minutes. So if something doesn't feel right to you, trust your gut.
Speak up.
Yep.
All right, Dr. Jen, thank you very much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.